Here we are with another topic of gynecological sketchy series. Today our topic is going to be menorrhagia. First of all, what is menorrhagia? Menorrhagia can be defined as the menstrual flow which is more than 80 ml, which contain more than 80 ml of blood, which can be defined as this. It is this box, as you know, the sketchy symbol of menstrual flow. So the menstrual flow that contain more than 80 ml of blood can be defined as menorrhagia. So what are the causes of menorrhagia? Before going into the causes of menorrhagia, first of all, the when a patient comes at your clinic with a complaint of menorrhagia, you should ask whether the symptom starts at menarche or not. If they said yes, then there is less likely to be associated any pathology. So this can be symptom like if the menorrhagia is present from at the start of puberty at a menarche, then this is less likely to be associated with any pathology. So let's dive into the causes of menorrhagia. First of all, the menorrhagia can be defined as, and most common cause is the fibroids and endometrial polyps, adenomycosis, coagulation disorder, endometrial cervical carcinoma, and pelvic inflammatory disease, and intrauterine contraceptive device, worth, warfarin, and thyroid diseases. So these are the causes of menorrhagia. So first of all, we have to discuss which characteristic features will point out towards a specific etiology. First of all, if there is a irregular bleeding, like this box with 35 symbol represent oligomenorrhea or irregular bleeding. If there is a irregular bleeding in between the periods, and there is also pain associated after sex, sex symbol, three features: pain after sex, pain in between the periods, and there is a irregular bleeding. Then you should do a pelvic ultrasonography, and these are most likely to be associated with endometrial polyps. So, and then if there are urinary symptoms or compressive symptoms, then these are associated with fibroids. And if there is a pelvic inflammatory disease, then it is associated with unusual vaginal discharge. And if it is associated with coagulation disorder, it is associated with bleeding from other sites, and there is a positive family history, post-surgical bleeding. These are the causes of menorrhagia. So let's go on to the physical exams of the menorrhagia. First of all, you should check the sign and symptoms of anemia, which check the signs of anemia. An examination, you should also assess abdominal and pelvic cavity for any visible pelvic mass or abdominal mass. You should also take cervical swabs and cervical smears if infectious is indicated. We will go into the investigations. In the investigation, first of all, check the FBC, full blood count, coagulation profile, and then check for an endometrial then check for pelvic ultrasonography. And endometrial biopsy is indicated when there is a high risk factor of endometrial carcinoma is present, like age above 45 years. Endometrial biopsy is usually very sensitive, and its sensitivity can be increased by the use of cut diameter of 4 mm of endometrium plus TVUSS, which is TV ultrasound, can be represented by this symptom, can increase the sensitivity of the endometrial biopsy. Endometrial biopsy is indicated when endometrial biopsy is indicated when other ultrasonographic diagnostic procedures are insufficient or inconclusive. So the last management or the last the last diagnostic procedure in a patient that is presented with the complaint of menorrhagia is the hysteroscopy. Like you can see this symbol, hysteroscopy. This is all about the management and the clinical feature of menorrhagia. So we will go on to the next sketchy picture for the management and treatment options of menorrhagia. On to the next one.